Hello everyone, and welcome to this launch event for the Trinity Challenge on Community Access to Effective Antibiotics. My name is Louise Gough. I'm the Chief Operating Officer of the Trinity Challenge, and we are delighted that you've joined us today to hear more about this global £1 million innovation challenge. During this event, we'll be hearing more about the critical issues of antibiotic stock control and substandard and falsified antibiotics in low and middle income countries, how the challenge seeks to mitigate these issues, and you will also be able to find out more about how to apply. Trinity Challenge colleagues are available to answer any of your questions in the chat throughout the event, but we will be covering a number of frequently asked questions towards the end of the event as well. Please use the chat to tell us where you're joining us from and also your background and specialism. We'd love to hear from you. For those who are not familiar with the Trinity Challenge, we are a UK charity set up by Dame Sally Davis in 2020. We support data-driven solutions to help protect against global health threats. Alongside our innovation challenges, we also support a portfolio of advocacy, research and campaigning activities. After the success of the first challenge on pandemic preparedness and response, the charity moved on to antimicrobial resistance, which now, more than ever, needs the attention of the world's innovators. Our last challenge called for applicants to bring forward solutions to reduce the impact of antibiotic resistance by harnessing the power of data from communities in low and middle income countries. We received 285 submissions from 57 countries and awarded 4 prizes to solutions in Vietnam, India and South Africa. And these brilliant teams are now starting to implement their solutions. So a bit more about the panel that will be joining me today. I'll be joined by Marc Mendelson, Director of the Trinity Challenge, and Noel Shaskan, Health Community Lead at MIT Solve, our key partner in this challenge again. First, we're going to hear from Marc, who will take us through all the details about this new, exciting challenge. Thanks, Marc.
Thanks very much, Louise, and big welcome from me too. I'm delighted that you've been able to join us and that you'll hopefully be looking to put in a solution to this incredible challenge of antimicrobial antibiotic resistance. Next slide, please. So for those who are new to the field of antibiotic resistance, I think there are some important issues to lay out. First off, that this is one of the great global public health crises, and it affects all those across the One Health platform, which is human health, animal health, and environmental health. Now, just in terms of the terminology we're going to use, although we refer to antimicrobial resistance, that in itself encompasses all different microbes, bacteria, fungi, viruses, and parasites. What we are going to be talking about, what we're focusing on, is antibiotic resistance, i.e. resistance of bacteria to the antibiotics that are meant to treat them. Next slide, please. So why act on this? As said, this is truly a global public health crisis. In the worst case scenario, the estimates are that 39 million people will die in the next 25 years. But more importantly, it undermines modern medicine as we know it. We need functioning antibiotics to be able to treat and prevent infections, and particularly in highly vulnerable individuals, such as those on cancer chemotherapy whose immune systems are reduced, those undergoing surgery who we need to try and prevent an infection in the wound, and then again in blue sky things like transplantation. But really on an everyday basis, it's common infections around that we see in the community, be they urinary tract infections, pneumonias, meningitis, etc. So undermining modern medicine is the issue in health security for humans. But we as humans also need food, and for food security, we need functioning antibiotics to be able to treat sick animals. And as you can see on this slide, the estimates of what antibiotic resistance is going to do to our livestock production and what that means for the loss of cumulative GDP in the billions of US dollars, it shows how critical it is that we get this right. It will affect, if we do not mitigate antibiotic resistance, it will affect between 746 million and 2 billion people, according to a WOA and World Bank report last year. Misuse and overuse of antibiotics in food production increases costs of producing our food and threatens our livelihoods. Next slide, please. As One Health, we are also, of course, interested in the environment and pollution with antibiotics, and indeed antibiotic-resistant bacteria through a lack of safe sanitation is a critical, important part of this whole One Health issue. However, for this particular challenge, we will be focusing more on human and animal health related to by stock control and substandard falsified medicines. And there is also a geopolitical security risk with 24 million people estimated to be pushed into poverty within the next 5 years. So next slide, please. When we talk about this challenge, what we're particularly interested in is community access to effective antibiotics. Now, there are many factors which play into ensuring access to effective antibiotics in the community. And we've chosen two really major problems, that of stock control and that of the use of substandard and falsified oral antibiotics. How can we use data and technology to improve these two areas in low middle income country settings in communities? Next slide, please. So we'll be focusing on these two categories, stock control and substandard falsified antibiotics, oral antibiotics. So stock control first. This is a real, stock control is a fairly complex system. It, of course, starts by manufacturing and goes through all the supply and demand chain all the way through to the end user. And we're looking for innovation, particularly in areas of stock control at the subnational and local level. So rather than at the national level, we're looking more, again, at the community level. What about substandard and falsified oral antibiotics, which antimicrobials are around 10% falsified and substandard in the world that are actually used by people? And we need to understand much greater, in a greater way, how we can improve the surveillance, the control of these antibiotics, and we must ensure that people are getting quality antibiotics rather than these substandard and falsified. Now, just to mention the difference for those who are not in this field, a falsified antibiotic is an antibiotic which is fraudulently made. Often there is actually nothing in there at all, or it may be something completely unrelated to the drug you think you're getting. Substandard, on the other hand, is when it doesn't meet its quality standards or specifications, sometimes because the active product that's actually in there isn't the right product, or that there is just too little amount of it in there. Why are we focusing on oral antibiotics? Because oral antibiotics are the antibiotics that are given in the community infections, and also in animals, we want to focus on antibiotics in feed and in water. Next slide, please. So the two are, of course, linked. If there are problems with stock control, people are going to try and find antibiotics elsewhere. Now, that might be actually quality antibiotics, but they may be the wrong type. So they may be broader spectrum antibiotics, in other words, which will ensure that they're more likely to get antibiotic resistance. But also they may be substandard and falsified medicines, because if you can't get them from your normal supply, you may go and look elsewhere into informal sales where they may be substandard and falsified. And this lack of access obviously plays into our ability to actually prevent and treat infections, so morbidity and mortality increases. And in some cases, depending on whether it's a substandard or falsified medicine, that may increase antibiotic resistance. Next slide, please. Why focus on low middle income countries? Because that's where the hammer blow is. That's in low middle income countries, we have a greater amount of burden of infection, we have greater use of antibiotics, and that can generate increasing antibiotic resistance. Also, why are we interested in low middle income countries? Because most of the data that we have in trying to mitigate, in our responses and trying to mitigate antibiotic resistance comes from high income countries, and particularly laboratories that service hospitalized patients. So there's a major gap in the community, particularly at community level data in low middle income countries, which is where we want to focus our attention. Next slide, please. So in terms of the challenge itself and our prizes, we aim to give up to £1 million in funding. We are aiming to offer a grand prize in each of the categories of stock control and substandard falsified medicines. So together, those prizes would go up to £1 million in funding. And we hope that with our member coalition, we hope to give support, mentoring, networking, collaborations to our winners. Next slide, please. We are extremely fortunate and thankful to all our members, leading philanthropies, institutions, companies that you can see represented here, who are actively engaged in the Trinity Challenge's work, and hopefully of that of our winners. Next slide, please. So in terms of eligibility criteria, the challenge solution must focus on low middle income countries. It must focus on the community level, i.e. not hospitalized data or industry level data. So we're looking at community health data, we're looking at farms in the animal health part of it, etc. What we're looking for is innovation. We want innovation in the way we collect, use data, how we analyze data, what types of innovation we're using, be it AI, be it machine learning. However, we're looking for these innovative ideas. It can be across One Health. As said, we're really focusing on human and animal health when we think about stock control and substandard and falsified medicines. But if you can bring the environment into it, fantastic. The impact, we want these solutions to have a public health impact, and we want them to be low cost and potentially scalable. That's what we're looking for. Next slide, please. The criteria the applicants must have include, in terms of status, a legal organization must, a lead organization, sorry, must be legally registered in its home country, in its home jurisdiction, with a bank account in its name, and will be liable for the award agreement. In terms of partners, consortia of partner organizations can apply, but the one partner acting as the legal organization for the award agreement must be in place. With low middle income countries, organizations can be based anywhere in the world, but if their lead is a high income country organization, it must show in its application a bona fide partnership with low middle income countries, and 60% as the minimum funding must be spent in the low middle income countries. You'll be able to find full eligibility criteria on the challenge application platform. Next slide, please. And so just to show you the timeline, we are launching our applications today on the 19th of February. The application deadline will be at the end of April on the 24th. We'll then start the process of judging. That will include finalist pitch interviews, and we hope that the awards ceremony will be in August. We'll then go into a contracting phase between September and October with a project launch date set in November. And importantly, this is a 2-year maximum period of funding up until October 2027. Next slide, please. So with that, I'm going to hand over to my colleague, Noel Shaskan from MIT Solve, who's going to take us through the platform and MIT's role. Over to you, Noel.
Thank you, Marc. Hi, everyone. It's great to see you all. I'm really excited to be here and to share a little bit more about MIT Solve and the application process. Next slide. So MIT Solve is an initiative at MIT that's focused on social impact innovation. We both run our own innovation programs and help other organizations run innovation programs on a variety of topics, including global health. And we're really glad to be collaborating with the Trinity Challenge again this year. Next slide. So to learn more about the Trinity Challenge or apply, you can either go to www.solve.mit.edu and navigate to Challenges, then Open Challenges, or go directly to the page using this URL, which we'll also drop in the chat. Next slide. So when you get to the challenge page, you'll find all the information you need about the topic, the timeline, eligibility, judging criteria, and more. And if you applied last time, you'll notice that our website has gone through a little bit of an update. All the same information is still there, just with a slightly different look and feel. Next slide. So if you decide to submit an application, you'll see that it's broken up into a number of sections. As you complete sections, a green check mark will appear to help you track your progress. You can also use the navigation to jump around and look at all the different questions in the different sections before you get started. We always recommend filling out as many questions as possible, even though only a subset are required, because that tends to increase your chances of being selected. Next slide. So something new this year is the solution profile section. It has a few high-level questions about your solution and your organization. You can save these questions as a starting point if you want to apply to other solved challenges. Also, if your application makes it past our initial screening process, the questions from the solution profile section will be viewable publicly. All the other questions in the application are only viewable to our staff, reviewers, and judges. Next slide. You'll also be prompted to submit either as an individual or as a team. This has to do with, one, whether you want others to be able to collaborate on the application with you, and two, if you want your collaborators to display publicly on the website. This is not how the reviewers or judges will evaluate your team and your expertise. Instead, they're going to be looking at the section of the application called More About Your Team. So use this team option if it's helpful to you, but know that it's not required. Next slide. You have the option to either save or submit your application as you go through and fill it out. We really recommend submitting as soon as possible once you finish the required questions, because you can still go back and edit a submitted solution right up until the deadline in April. Please don't be one of those teams who works really hard on an application, but then misses the deadline and can't be considered. Next slide. Okay, a few last tips to help you really put your best foot forward in your application. Be sure to review the challenge overview and criteria pages really carefully. They may be able to help you frame your solution in the most relevant way throughout your application. Be sure to communicate the key details that we need to know, but try to be concise in your answers. Don't be overly technical. The most successful applications that we see typically communicate complex technologies and concepts in really simple language. And I mentioned these last two earlier, but they bear repeating. Fill out as many questions as you can, not just the required ones. And please don't submit at the last minute. Submit early and then feel free to refine right up until the deadline. Next slide. All right, finally, if you run into any trouble, we are here to help. There's a great set of FAQs on the challenge page. You should start there. If you can't find what you need there, you can always email us at help.solve.mit.edu. And lastly, we will be hosting a Q&A webinar on March 31st. We'll drop the information in the chat if you would like to join. All right, everyone, thank you so much, and back to Louise.
Thank you, Noel. Thank you, Marc. That's brilliant. So we've got some frequently asked questions that we'd like to go through to help you understand a bit more about this challenge and a bit more about the application process. So I'd like to start with Marc, if that's okay. We've focused a lot on the term community, both in the last challenge and this challenge. Could you expand on what we mean by this and the challenge's requirements around community level data?
Yeah, so as I said previously, the majority of the data that we actually have to help plan our interventions and to understand antibiotic resistance really come from hospital laboratories that are servicing hospitalized patients. Now that gives us a skewed understanding of the actual situation of how much antibiotic resistance in bacteria is happening in the community, because the people that go to hospitals and are admitted and therefore have their samples submitted often have already had antibiotics in the community, so antibiotic resistance has already started to be generated, and then they're given more antibiotics, which worsens things. So the types of bacteria and the resistance you see is very high level, very serious in the hospitals, but it doesn't tell us much about what's actually going on in the community. So when we're talking about community for human health, we're really talking about those people accessing health systems outside of hospitals, be they health clinics, or of course, many people access antibiotics informally through pharmacists and others in low middle income countries. And that's particularly why we're interested in substandard and falsified medicines. In the animal health field, a lot of the data, or there is very little data, particularly in low middle income countries, but much of the data comes from the food industry. So again, we're more interested in the community level, be they subsistence farmers, small holdings, etc. So that's the area we're really interested in impacting on.
Thanks, Marc. And another really important criteria for this challenge is the focus on oral antibiotics. Could you just explain a bit more about why that focus and what that means in practice?
So that focus really talks to the fact that the important antibiotics in the community are almost always oral antibiotics. So the World Health Organization categorizes antibiotics into three groups, so-called the AWARE classification, and it's the access antibiotics, those narrow spectrum workhorse antibiotics like penicillin and amoxicillin and really narrow spectrum antibiotics that we're really interested in, because we know those are what people in communities in low middle income countries actually need. Now, we haven't said access antibiotics, we've said oral antibiotics, because we're also cognizant of the fact that there are a couple of antibiotics in the next category, watch, and particularly ciprofloxacin and quinolones, and sometimes the macrolides that are used in certain community infections as first line, and that would be usually typhoid. So we are looking at oral antibiotics, and also, of course, in animal health and in food production, the majority of antibiotics are given orally. So that's why we're focused on this, and that's where the problem is in low middle income countries. And again, the substandard and falsified medicines and the substandard falsified antibiotics that we're interested in are usually these oral antibiotics.
Thank you. And could you just explain a little bit about the difference between human and animal antibiotics in that context?
Well, in terms of delivery, excuse me, in terms of delivery, antibiotics in food production systems are often that we give our food production animals are often in feed. They're already mixed in with feed, or in water that's given. And in humans, I mean, oral antibiotics You want to use an oral antibiotic whenever you can. Usually, you only use intravenous antibiotics generally in hospitals. There are occasional, obviously, antibiotics that you would be given in the community as an injection, but those aren't the ones that we're really focused on. We're focused on oral antibiotics, particularly the access category group, and that's the focus of this challenge.
Thanks, Mark. And I'd just also like to ask you to talk a little bit more about One Health. So you introduced this concept to us at the beginning of the webinar. Could you say a little bit more about, are you looking for one particular part of the One Health continuum for this challenge, or multiple?
So just to recap, One Health being human health, animal health, and environmental health. This challenge with stock control and substandard falsified antibiotics and their access to those effective antibiotics really talks to two of those three areas, human health and animal health. Now, we would be delighted to see solutions that cross the two areas, but we're also happy to have solutions that only are restricted to the human health field or the animal health field. So really, that's up to you. There is no absolute that it has to be more than one category, but recognizing that antibiotic resistance is a One Health problem, we're looking for solutions that can help in really either of those fields.
Thank you. And just one more question for you before I move on to Noel. I'm hoping that people watching this and finding out about the challenge will be really excited and want to put in all sorts of different ideas for their solutions. Can the same team submit multiple applications?
So we really encourage teams to concentrate on their most promising solution. As you said in your introduction, the Trinity challenge, the last Trinity challenge on antimicrobial resistance, we received over 280 applications and we had 4 winners. So the competition is already tough. If you're putting in multiple applications, they would have to be completely different from each other. But I would really strongly advise you to put in your best, most promising solution. And to point out importantly that the team lead, or often we call the principal investigator, can only be associated with one single application. So multiple solutions from a single organization are unlikely to be advanced to the semi-final stages.
Thank you. Good tip for everyone there. Focus your ideas on the best application you can. Thanks, Mark. I'm going to turn to Noel now. Could you talk a little bit more about that application window and how people can utilize the challenge application to their best advantage? So can they start applying and then go back to it later and improve it right up until the deadline?
Yeah, thanks, Louise. So as I said earlier, challenge teams can submit their applications and then continue to edit and refine all the way up to the challenge deadline on the 24th of April. And we definitely recommend getting your application in at the earliest opportunity so you know it's in the system, and then coming back to edit if need be. It may also be helpful if you have your application submitted, or at least have clicked through the different sections of the application to review before that Q&A webinar on March 31st. That way you can join us with the full context of the application and the process and have all your questions answered.
Great, thank you. And I'll stick with you for now, if that's okay. So some of our viewers may be working in adjacent fields to antibiotic resistance, stock control, or substandard of falsified antibiotics. And they may be working in technology that hasn't been applied to this issue before. Can existing solutions outside of this antibiotic space apply?
Yes, absolutely. A key focus for this challenge is innovation. And sometimes the most innovative solutions come from those who have that outsider's view of the problem. So we absolutely encourage you to apply. That said, if your background is not in antibiotics or AMR, you may want to consider a collaboration with others who do have that expertise. Collaborations and consortiums are definitely encouraged for this challenge.
Great, thank you. And also, could you tell us a little bit more about how developed a solution needs to be before you can apply?
Sure. So the challenge is seeking solutions that can be developed and scaled over that strict 2-year funding period that was mentioned earlier. So to be eligible, your solution cannot be a concept or an idea. It must be at least at the proof of concept stage, which we define as having a prototype which is ready to test with preliminary evidence or data having already been established. So any solutions past this stage, proof of concept, are also very welcome to apply. They could be at pilot, growth, or scale stage of their development. And when you apply, you will be asked to specify what stage you're at and provide some information about that stage.
Great, thanks, Noel. I'm going to turn back to Marc now. So Marc, you mentioned the Trinity Challenge members and some of the opportunities there for collaboration. Could you expand on that a little bit more? So tell the viewers a bit more about what benefits they might have from winning one of these prizes.
Yeah, no, thanks, Louise. So as mentioned, our members come from a real range of areas and that could be important. So again, philanthropies, institution companies, professional bodies, etc. And in the past challenges, they really brought significant value to solutions which align with their individual missions. Of course, each have their own individual missions. So one example is Amazon Web Services. In our last challenge, they supported 3 of the winners of the Trinity Challenge on antimicrobial resistance with $750,000 US dollars in cloud computing credits under their health equity initiative. And whilst others have provided more informal networking or support. So, it really is tailored to what they can offer and of course what you need. But we work closely with finalists and winners to identify where the projects need support, where we can bring value, our members can bring value, and really through forging those connections with our members or a wider network of collaborators. But this is, again, tailored to individual needs, and it's dependent on the relevant resources. So it's not guaranteed, but it's potentially a huge value on top of significant prize funding.
Thank you. And now I've got a couple of questions around the type of organisation that can apply. So obviously antibiotic resistance and antimicrobial resistance is a big priority for organisations across the world, particularly governments and their agencies. I'm sure this funding is going to be of great interest to those kind of organisations, but are they eligible to apply, governments or their agencies?
So unfortunately, we've had to take the decision that some are not able to apply. So governments and their agencies are not eligible to apply. Similarly, pharmaceutical companies are not eligible. And this is really because the challenge focuses on interventions at the community level outside of traditional hospital manufacturing settings, where these sort of entities typically have influence over and where we tend to have the most data. So it may be that your solution somehow integrates with the systems of these types of entities, or that they're needed to support key phases such as regional and national rollout, and that's fine. But governments, their agencies, pharmaceutical companies cannot be the recipient of the prize funding. These and some other restrictions, of course, relating to for-profit companies are noted in the challenge eligibility criteria, which I encourage you to read.
Just one quick follow-up on that. We get a huge amount of interest from universities for these kind of challenges. Are universities eligible to apply?
Yeah, so no, universities can apply, even if they're state funded, assuming that the funding is ring-fenced within this institution, as is normally the case.
Great, thanks, Marc. I've got a couple of questions for Noel now. So in the application process, we ask teams to submit budgets for the full £500,000 grand prize, but we also asked them to highlight what changes might happen to their project if they were to receive £250,000. Could you explain why we do this and any other budget restrictions that the team should be aware of at this point?
Sure. So all applicants should be working towards one of the two planned £500,000 grand prizes. However, we never know what can happen over the coming months. It's possible that the prize fund could increase or that the judging panel will be really impressed and maybe want to recommend some additional runner-up prizes. With this in mind, we asked teams to briefly outline a £250,000 version of their projects so that if any extra funding does become available, it can be best allocated. It is worth noting that your project may simply not be viable with a lower prize value. If that's the case, that's okay. Please just state that in your application. Doing so will not damage your chances of being selected. And our main focus when reviewing will be your answer to your budget for £500,000. One other tip around budgets, the Trinity Challenge does have some specific parameters around how funding can be spent, how you should organize your budget into categories, things like direct costs, real indirect costs, true overhead costs. And there are also limits for contingencies and overheads. The Challenges FAQ page has a full breakdown of this that you should definitely try to review before formulating your budget.
Great. Thanks, Noel. And to Marc, Noel's spoken about a few different financial restrictions for this challenge, but there's also one very important criteria about funds being spent in low and middle income countries. I know you've mentioned it already, but I think it's important to reiterate now to our viewers how important that is and what does that mean in practice.
Yeah, it's critical. The focus of this challenge is low middle income countries. So the majority of those funds, and that is a minimum of 60% of the funding, must flow to low middle income, flow in middle income, low and middle income countries. Now, of course, this is primarily a consideration for projects that where the principal investigator or the institution is in a high income country. As said, it has to demonstrate bona fide partnerships with the low middle income country, and 60% has to be spent there. So in the case of the high income country partners costs, which includes personnel in these facilities, travel, etc., that would be capped at 40% of the total budget. Now, I can't stress this enough. This has to show bona fide partnerships and a minimum of 60% absolute minimum threshold for low and middle income countries. If your budget doesn't relate to these criteria, you're not going to progress.
Thank you. Really important to note that. Noel, could you clarify whether applicants can use generative AI in developing their applications?
Yes, this is a tricky one. I know a lot of people have been using generative AI like ChatGPT. So for this challenge, the use of generative AI is not banned, but it is discouraged. We really want to hear your voice and your passion and ideas, and only you can properly express these. If you do use generative AI, the key here is to use it minimally and justifiably. So for example, if English is not your first language and you want to use Gen AI to check your wording, that's okay. I want to caution you, though, that over-reliance on generative AI will likely disadvantage your application. If you are found to have included any exaggerated, misleading, or fabricated information, you may be disqualified from the challenge. And we will be screening for this specifically throughout the judging process. So please just be very cautious with using these tools.
Thanks, Noel. Really important point. Thank you. Marc, so one of my final questions for you. It's an application criteria that solutions provide a public benefit that would be globally accessible under fair, reasonable, and non-discriminatory terms. So what do we mean by this? And in particular, what are the implications for the solution's intellectual property?
Thanks. Again, an important question. So we're looking for this funding to be given on the basis of delivering at least one public good as its output. And this has got to be easy to access by interested parties for the well-being of the public, obviously, as a public good. And so that could be, for example, as being free or only carrying a nominal fee. So what type of examples of public goods? Are they data sets? Are they services? Are they open source models, free to use dashboards? These are just some of the possibilities. And your public good is likely to include intellectual property rights. And whilst you release this into the public domain, you'll continue to be the rights holder. And the Trinity Challenge will not hold any rights to your property, which is again an important distinction. You will stipulate your public goods in your good. You will stipulate, such a final question. You will stipulate your public good or goods in your application. So thank you for that.
Thanks, Marc. That's brilliant. Thank you both for those answers. Really, really helpful for the viewers. I would like to just finish this section by asking you both the same question, but I'll start with Marc, if that's okay. So Marc, what difference do you think these solutions could make to people's lives?
Well, hopefully I found my voice again. So this is all aimed at improving community access to effective antibiotics, be it for humans, animals, or both. And this increases the likelihood of successful prevention and treatment, which is really what we're trying to do. And also, of course, limit the possibility of worsening antibiotic resistance in the community settings and in the countries in total. And if we can prevent stockouts with some of your solutions, and we can reduce the use of substandard and falsified antibiotics, this is really going to make major impact on effective community access to antibiotics. Thanks.
Marc, and the same question to you, Noel.
Thanks, Louise. What a great question to end on. This is such a significant, growing, and at times overlooked problem, as Marc mentioned. Time and again with Solve, I've had the pleasure of seeing how technology, data, innovation, when done right and led by communities, can really help tackle these types of problems and make a lasting impact. And just based on the solutions that we saw for last year's Antimicrobial Resistance Challenge and the progress and impact that they've already made, I have no doubt that we're going to see some really game-changing ideas here that could ultimately save, tens of millions of lives. So really excited to see the work that you all are doing.
Thank you, Noel. Thanks both. Ultimately, that's what it's all about. So great question to end on. Thank you so much to both Marc and Noel, and to all of you for joining us today. It's been a pleasure to host this event. And thank you also to our funders and supporters and everyone that's provided their expertise in getting us to this point. But in particular, I would like to take this opportunity to thank our funders for this challenge, both Wellcome and the Institute of Philanthropy, empowered by the Hong Kong Jockey Club Charities Trust, without whom this opportunity would not be possible. And also, like I said, thank you to all the people that have provided their insights and expertise and have supported the development of this challenge over many months. We really appreciate it. If you have any questions about the challenge after joining us today, you can email us at info@thetrinitychallenge.org. And we also have a very short survey that we will circulate after the event. It will pop up after we finish, and it will just take a couple of minutes. We'd really appreciate you filling that in for us. As we've already mentioned, there is another opportunity to ask some questions. So we have a Q&A webinar on the 31st of March, and we will share the link for you to register shortly. Please do sign up and come armed with all your questions. For the latest challenge news and updates, you can follow the Trinity Challenge across all of our social media channels. You can see those on the screen now, and we can again share those with you. That's all that's left to say for this event. Thank you so much for joining us. We really look forward to receiving your applications. Good luck. Please get those applications in by the 24th of April. And for now, goodbye.